How IM injection technique. Buttock gluteal muscle injection step by step. Intramuscular IM injections are commonly used in healthcare to deliver medications directly into muscle tissue, where they can be absorbed efficiently. The gluteal region is one of the areas healthcare professionals may use for certain medications when clinically appropriate. Safe IM injection practice requires proper education, knowledge of anatomy, careful patient assessment, and adherence to evidence-based clinical guidelines. Every IM injection begins with careful preparation. Before administering any medication, the healthcare professional reviews the physician's prescription and verifies the patient's identity using approved identification methods. The medication name, dosage, expiration date, and prescribed route are carefully checked. Patient allergies and medical history are also reviewed to help prevent medication errors and adverse reactions. Hand hygiene is performed before preparing the medication. The healthcare professional gathers sterile equipment, including the prescribed medication, syringe, needle, alcohol swabs, gloves, gauze, and an approved sharps container. Maintaining a clean workspace and using aseptic technique are essential for reducing the risk of infection. Communication is another important part of patient care. Before the injection, the healthcare professional explains the purpose of the medication, discusses what the patient can expect, and answers any questions. This helps reduce anxiety and encourages cooperation throughout the procedure. Respect for patient privacy and dignity is maintained at all times. The patient is then positioned comfortably according to clinical practice. Healthcare professionals use accepted anatomical landmarks to identify the appropriate gluteal injection site. Site selection depends on the medication being administered, the patient's age, body size, muscle development, and institutional policies. Proper anatomical assessment is a skill developed through professional education and supervised clinical training. Once the appropriate site has been identified, the skin is cleaned with an approved antiseptic and allowed to dry completely. Throughout the procedure, sterile technique is maintained. The healthcare professional administers the medication according to current clinical protocols while monitoring the patient's comfort and response. Immediately after the injection, the needle and syringe are safely discarded into an approved sharps container without recapping. Proper disposal helps prevent accidental needle stick injuries and protects both healthcare workers and patients. Documentation is a vital part of every medication administration. The healthcare professional records the medication name, dosage, route, injection site, time of administration, and the patient's response in the medical record. Accurate documentation ensures continuity of care and supports patient safety. Following the procedure.